Next up, we have another ecosystem stakeholder leader within the New York City metro area, Dr. David Berger, the CEO of SUNY Downstate Medical Center, and someone who's been contributing not only as an executive leader, but as a clinical leader in medicine and healthcare delivery over the last 40 years. And really appreciate his giving some time and some energy to the program today, given everything that he's got going on. Just an incredibly busy schedule, and certainly our community appreciates that. Dr. Berger, welcome to the program.
Thanks, Stan.
If you could start with just a little bit of background on yourself and share some of your journey to the HITLAB community here.
So I am a surgeon by training. I am a general surgeon and surgical oncologist and trained at MD Anderson. I've been in hospital administration now for about 20 years. I've been the CEO at SUNY Downstate since 2020, came in after the first wave of the COVID pandemic. And my job was really to turn around the academic medical center. And a large part of turning around the academic medical center is relying on and using digital tools to better deliver patient care. So that's a little bit about me. I want to just talk a little bit about how I look at implementing artificial intelligence. So as everyone knows on this meeting, artificial intelligence has exploded in the last several months with OpenAI, ChatGPT, and the various other large language models that are out there. I cannot go a day without being solicited by at least 3 new AI companies trying to sell me something and sell something to my hospital and to my health system. So I think it's important to start thinking about how we actually evaluate and decide what AI solutions we're going to implement within healthcare. So the first thing we need to think about as healthcare leaders is, what's the problem we're going to tackle? Is there strategic alignment between either the product or the question that's come up and been raised by either our clinicians or our staff with the strategy of the hospital? Secondly, when we're thinking about what problem to tackle, will there be a measurable impact? Specifically, will there be a change in finance? Will there be a change in the number of patients we see? Will there be a change in our quality metrics? Third thing that is really important nowadays is, will AI augment or replace human interactions? Because we are uncertain on what the appetite is for people to directly, continuously interact with computers versus interacting with humans, especially in the healthcare setting. And then, are we actually replacing humans and potentially putting people out of work? So, and then the fourth thing in terms of thinking about the problem, is this a problem that we really need AI to solve? Is there another way to get at this that's simpler? And is AI really the solution, or is it just a fad and something that sounds really fancy for us to do? And then finally, when we're thinking about a problem to tackle, is, are there the necessary organizational resources in place to be able to implement the AI solution that we're thinking about? So we had a problem, and the problem was being able to contact our patients after they were discharged to make sure they got their medications, they had all their follow-up appointments, etc. What we were doing, we were using advanced nurses to call patients and try to reach them and make sure everything was okay. We were only reaching about 40 or 45% of our patients with these phone calls. And we were using 2 highly qualified, very expensive FTEs to try to get this done. So I thought this was pretty simple. It was aligned with strategically with trying to reduce our readmissions, to increase our hospital satisfaction scores. It was going to relieve people of unnecessary repetitive work. So sounded like a great solution. So we started on a journey to implement AI chatbots that communicate with our patients by SMS text. What we started to find out when we did this was that there were a whole host of organizational resources necessary in order to make this implementation successful. And we've been working almost 7 months to get the implementation lined up. And I'll talk a little bit about implementation later as we continue in our framework. So the first thing is, what's the problem to tackle? Second thing with AI is the data available. Well, right now, you need less data than previous, when AI was just becoming important, before a lot of the foundational models were coming out, and all the data needed to be annotated. Now, with a lot of the foundational models, you need less data, but what has happened is that these foundational models are often a black box, and we don't know where the data has come from or what data is being used. And this can potentially lead to unintended bias in healthcare if populations that you're interested in taking care of are underrepresented in some of these models. So you need to know what data you have within your system. If you need data to populate these models, you also really need to have transparency into some of the foundational models to understand what data is being used in those models. This is really critical when you're thinking about any implementation or any AI solution. Who are the stakeholders? Who is going to use the system? Who is going to be affected by the system? And who are the people potentially being displaced by the system? So again, back to our implementation of our AI solution to contact patients. So one set of stakeholders was our patients. Second set of stakeholders were our nurses who were communicating with the patients. Third are the doctors who write the discharge and make sure that the patients are getting their medications and their follow-up. Some of the stakeholders that we didn't understand were actually our legal office, as well as our registrars. So we initially thought, okay, we have a business agreement with the company. They can then contact the patients and it wouldn't be any problem. Well, when we went to our lawyers, they quickly said, no, 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 no. You are sharing potentially data with an outside company. You need permission from the patients in order to have a third party act as the contact for them when they get discharged. So then a whole new set of stakeholders became involved. And those are our registrars. And those are our clerks on the floor to see which of the patients actually agreed to being contacted versus those patients who did not want to be contacted. So it's very important upfront to understand who are all the stakeholders involved when implementing any type of AI solution. This is important, especially when you're using AI for clinical decision-making. It's less important in the example I gave in terms of the transparency. But if you were using AI to, for example, read mammograms, the physicians, first of all, the radiologists, but also the patients, as well as the doctors referring the patients for mammography, are going to want to know how you came to be able to have a computer read a mammogram, and are the results from the computer as good as the radiologist. So you need to be able to ensure transparency into the model and into what the model is doing. Again, back to our solution with contacting our patients using the AI chatbots is, what is the implementation strategy? So in our case, we significantly underestimated the implementation strategy because we didn't account for all the stakeholders early on. But we took a step back and we went through it and we were able to get over all the hurdles. But what was key in terms of our implementation strategy was once we identified all the stakeholders, we made sure they all had input into the process. Measuring whether your implementation is successful is the final important key to the whole picture. And that's not just waiting till the end to seeing if it worked and you were able to generate the data you wanted to generate, but there should be steps along the way and along the path, especially if you're implementing AI and in decision-making for an important healthcare issue. And go back to the example around mammography. So AI reading mammography did not start out by just reading mammograms. What the initial approach was looking at the problem of reading breast density. And what they found was that there was significant discordance amongst radiologists reading breast density.
This is great. We've got about 1 minute left, Dr. Berger.
They identified that breast density was an important factor in breast cancer risk. And instead of starting with reading the mammography, they started with reading whether there was dense breasts on the mammography, and they were able to show success at that. And then that was the first step in being able to go to implementing AI to help read mammograms.